And just ahead this hour on First Coast Connect, the coronavirus vaccine is finally here. Now, the huge logistical challenge is underway into getting people vaccinated in our community and across Florida. We'll have the latest on those efforts just ahead. Then later.
This money is a recognition of the hard work of our team and our partners, and also of the high need in our community.
A game-changing donation for the United Way from the former wife of Amazon CEO Jeff Bezos. What it means for this community. All of that and more is just ahead. After the day's news.
Live from NPR News, I'm Janine Herbst. Who controls the U.S. Senate after two runoff races in Georgia has yet to be decided. But even though the race between Democrat Jon Ossoff and Republican David Perdue has not been called, Ossoff is claiming victory with about 16,000 more votes than his opponent.
It is with humility that I thank the people of Georgia for electing me to serve you in the United States Senate. Thank you for the confidence and trust that you have placed in me.
But Perdue has not conceded the race. Earlier, Democrat Raphael Warnock defeated Republican Kelly Loeffler, according to the AP. Warnock will be the first black senator from Georgia and tells NPR's Morning Edition the state has become more diverse.
Welcome to the new Georgia. It is more diverse, it is more inclusive, and it readily embraces the future. And I'm the product of that, among other signs that you can see right on the ground here in this state.
Warnock is also the first Democratic senator elected from the state in 20 years. Congress meets today to certify Joe Biden's win. And while there's no doubt that Biden is the president-elect, some Republicans plan to object to several states' electoral college results. NPR's Kelsey Snell has more.
Republicans have the chance to object to each state individually, and we really expect that will start with Arizona. Senator Ted Cruz of Texas and a group of others will start their objections there and plan to focus on calls for an electoral commission, not on setting aside the election results, is what I'm told.
NPR's Kelsey Snell. As many as 6 states could be at issue, and it could last all night because each objection can result in hours of debate. But Biden is expected to be certified in the end. Vice President Mike Pence says he will follow the Constitution, which means he will not go along with President Trump's request to send back votes, which Pence can't do. In Kenosha, Wisconsin, there were protests last night after prosecutors declined to charge the white police officer in the shooting of Jacob Blake last summer. He's a black man who was left partially paralyzed. NPR's David Shaper reports the district attorney found it likely that a jury would believe the officer acted in self-defense.
With a heavy police and National Guard presence keeping watch, a small but loud group of protesters braved the cold Wisconsin night, expressing outrage over the prosecutor's decision to not bring criminal charges against the officer who fired 7 shots into Jacob Blake last August. Leading the march was a 29-year-old's uncle, Justin Blake.
The impact of this verdict is going to have ramifications all over this state and all over this nation. And we will not let it rest until we get justice for little Jake and all the little Jakes around the nation.
The shooting left Jacob Blake partially paralyzed. His family will go to Washington in coming weeks to push for policing reforms. David Shaper, NPR News in Kenosha, Wisconsin.
While U.S. futures contracts are trading in mixed territory, this is NPR.
This is WJCT News 89.9 in Jacksonville. Good morning, I'm Michelle Corum. The attorney for ex-Clay County Sheriff Darrell Daniels appeared in court yesterday and entered a plea of not guilty. According to a report from our partner News4Jax, Daniels was removed from office in August while under state investigation over an extramarital sex scandal. He's charged with 3 misdemeanor counts of false statements to law enforcement and a felony count of evidence tampering. Florida added more than 15,000 new COVID-19 cases yesterday. As Abe Abaraya reports, Florida's in the midst of a record-breaking increase.
Florida's daily average is now 13,800 new COVID-19 cases per day, according to figures from Johns Hopkins University analyzed by NPR. That's a 43% increase compared to a week ago. The increased caseload is starting to strain Florida's hospitals. As of Tuesday afternoon, 7,300 people were hospitalized in Florida with a COVID-19 diagnosis, a 30% increase from 2 weeks ago. Statewide, 57 hospitals report having 0 intensive care unit beds, including 8 hospitals in Osceola, Seminole, and Volusia counties. Since the start of the pandemic, 1.3 million Floridians have contracted COVID-19 and more than 22,000 have died. The Institute for Health Metrics and Economics estimates another 10,000 deaths in Florida by April 1st. I'm Abe Abaraya in Orlando.
We have a clear sky here in Jacksonville. The temperatures are in the mid-40s. Sunny this afternoon, reaching the low 60s. We have a chance of rain tomorrow, 40% chance in the afternoon, partly sunny, upper 60s.
Support for NPR comes from iDrive, providing cloud backup, full system backup, and on-site iDrive appliance to protect PCs, Macs, and servers from data loss due to crashes and ransomware at iDrive.com/NPR and Americans for the Arts.
The vaccines, well, they're finally here. Now, the huge challenge of getting them into arms is underway. Good morning. We're live from Studio 5. I'm Melissa Ross, and this is First Coast Connect. Thanks for listening. Just ahead, demand is far outstripping supply as people across this region wait impatiently for access to the COVID shot. Are you one of them? Give us a call. 549-2937 to join us. Then later, we'll go inside those game-changing donations made to several local nonprofits by the former wife of Amazon CEO Jeff Bezos, what that means for this community. But first, this hour, the latest numbers on the pandemic. The state reports 15,431 new COVID cases overnight and 98 new deaths. The the cumulative number of cases in Florida stands at 1.39 million, with more than 22,000 dead and 1,300 new cases reported in Duval County alone Tuesday. So cases keep rising. It's not surprising, then, that the number one question on everyone's mind right now is how to access the vaccine for coronavirus. Plans to boost the pace of COVID vaccinations in Duval are getting bogged down by a limited number of vaccine doses, far short of the demand that's out there. Now, the city of Jacksonville is racing to open its own city-run COVID-19 vaccination sites. But in order to do that, they've got to first take delivery of vaccines in sufficient numbers to make the shots available. There just aren't enough shots in the area yet. So what's the latest on the vaccine rollout? We're going to begin the hour with a closer look as we welcome Dr. Sunil Joshi, president of the Duval County Medical Society Foundation. Doctor, good morning.
Good morning, Melissa.
And Dr. Jeff Goldhagen. He's the former head of the Duval County Health Department and chief of the Division of Community and Societal Pediatrics at UF Health Jacksonville. Hi, Dr. Goldhagen.
Good morning, Melissa.
So good to have you both, gentlemen, this morning. And here's our question to callers. Are you trying to get an appointment for a COVID vaccine? Have you already maybe been vaccinated? Are you maybe resistant to get the vaccine? Wherever you stand, whatever your story, we want to hear it. Give us a call. It's 549-2937 to join us. Emails to firstcoastconnect@wjct.org. Tweets to @MelissaInJax, or weigh in on our Facebook page. All right, Dr. Joshi, let's begin with you. I know you're going to be getting on a call momentarily with city leaders to get an update on this. Where do things stand when it comes to the rollout of the vaccine program for this area? Some people have already started getting vaccinated, but certainly there are many more still waiting.
Yeah, I mean, and that is really the issue, as you were saying in kind of your build-up for this, is that it's not, at least right now, it does not appear to be that where people are hesitant to get the vaccine. You know, we are having people crash the system trying to make an appointment to get the vaccine. The biggest issue is the supply, and you know, increasing the number of locations in which we can provide the vaccine is fantastic if you have a supply to do it. You know, if we have 1 million people roughly in this Northeast Florida region, if we're vaccinating 1,000 people a day, we're never going to get, you know, to where we need to be in terms of vaccinating the population. And so we're kind of in that stuck in neutral kind of mode right now until we can get more supply.
Right. Dr. Goldhagen, city leaders say that this is their number one priority. They just need to get more supplies. Supplies are controlled by the federal government and sent to the states, then distributed out to local communities. And so we wait.
Well, I have a little bit of a different opinion. This is amongst the most complex, largest public health emergencies that we have seen as a country. The sickness and deaths around us are an indictment of our public health system. So that the issue is not getting more vaccine. The issue is having a comprehensive plan in place that mobilizes all of the resources that exist in our community in order to be able to, number one, address the critical surge that we're dealing with right now, and number two, address the plan, establish a comprehensive plan to distribute and immunize about 800,000 people. We need to be thinking of this as a massive public health emergency. We need to be mobilizing all resources that exist. We need to be identifying the financial resources. If they're not coming from the federal government and they're not coming from the state, they need to come from within in order to be able to address this issue. The second thing is that it's not as if we don't have vaccine in the city. The hospitals have received tens of thousands of vaccines. What needs to happen immediately is that we need to have the city with the health department, if possible, actually taking charge of distributing the vaccine around the city. And then the third issue is that there needs to be equity in the plan for distributing those vaccines. So opening up one or two additional sites to be able to distribute the vaccines that we have is not addressing any of those issues. We do have the capacity now to say this is an immense public health issue. It demands an emergency response, and that we can immediately mobilize ourselves to fulfill that response. That's the issue, Melissa. That's the issue we need to deal with.
You're the former head of the Duval County Health Department, Dr. Goldhagen, and you've been quite critical of the way public health is being managed in this state since you left that position. How much blame do you feel needs to be assigned to state leadership as opposed to the lack of a comprehensive federal strategy on the vaccine rollout? President Trump has been credited with Operation Warp Speed, the development of vaccines. But now we're at the last mile, and it's always the last mile that gets you. And so who in your view, is most to blame here?
Well, certainly from the federal government. This isn't the last mile. The federal government did a good job. Trump did a good job with the Warp Speed. But from there's been no accountability, no responsibility. So the public health system has failed from the federal government down to the state, and from the state down to the local health department. And I've been really very, very careful to acknowledge the fact that the people in our health department are dedicated, competent people. The resources that they have to work with have just been decimated, and the public health system has been dismantled. Having said that, if the city and the mayor did a wonderful job in declaring the mask-wearing requirement. But if the city looks around and says, we're going to depend on the public health system, and there is no public health system, then the city needs to mobilize itself to fulfill that vacuum. And it has the capacity to do that.
All right.
The Emergency Operations Center works.
Let me ask Dr. Joshi to respond to that. Doctor, what about these criticisms of the way this is being administered at all levels of government?
Yeah, I mean, there's a lot of validity to what Dr. Goldhagen is saying. You know, it does start at the top with the federal government not having a comprehensive plan that we are all to follow is mind-boggling to me, because we knew the vaccine was coming out 6-7 months ago, and to leave things up to the individual municipalities in terms of how to distribute things seems a bit careless, because each county has different resources, and as Dr. Goldhagen stated very well, is our public health department here in Duval County has been disseminated in terms of the amount of funding that they've been receiving, not just here in Duval, but throughout the state over the last 2 to 3 years. And so that makes it very, very difficult to manage a vaccination program that we have never seen in our lifetime. And so I would agree that, this is a failure of government at the very, very top, starting with the federal government coming down. But then, we have to deal with that now. Now we're stuck in a situation where, okay, we have to do what we need to do to get people vaccinated. And even at that point, I think we've had some failures. The CDC is right now is recommending 75 years and up, and then, essential workers. But our state has decided to go 65 years and up, which adds another couple million people into the line of people trying to get appointments to utilize this vaccine, which, is somewhat scarce. So our supply is not reaching the demand even further because of somewhat of a unilateral decision by our state government.
Let's go to your calls now. Have you gotten the COVID vaccine? Are you hoping to get it soon? Give us a call. In a few moments, we'll have updated information on how you can register for your appointment to be vaccinated. But first, it's 549-2937. Byron is in Arlington. Hey, Byron, go ahead.
Good morning. Well, we had a hard time getting an appointment. Of course, we went through the phone bank, and that was a disaster. Then when the website opened up, my wife signed us both up. The interesting thing is that when I actually went for the vaccination at Prime Osborne, because of circumstance, I wound up being there an hour early, but nobody was there. There were no lines. They were all empty. And I was able to get a shot an hour ahead of schedule. My wife showed up early. They didn't even have her name on the list, and they took her because there was nobody there, and they had people standing around. And so we just thought that was very peculiar that after all this fuss, nobody was there.
Wow. Thanks for that, Byron. Glad you were able to be vaccinated.
Yes, thank you.
Thank you. Dr. Goldhagen, as the former head of the local health department, we're being told that people can start registering for new appointments beginning Thursday at duval.floridahealth.gov. They can register online. St. Johns County is also using online appointments at its website. Nassau County is going to be announcing a new round of appointments as it gets more vaccine. That's at onenassau.com. So wherever you live in this listening area, go to your health department's website, register for an appointment online. But what about Byron's experience? What are your thoughts about how this is unfolding across the community? I'm surprised to hear there wasn't a line of people at the Prime Osborne. I thought there had been a steady demand there.
Well, on the first day, I'm not sure when he was there. On the first day, there wasn't. The second day, there was the lines that we noticed on the media. But what Dr. Joshi had mentioned was really the critical issue. In this region, we have 1 million people that need to be vaccinated. Opening the computer systems to schedule appointments online is not the way that this is going to need to work. And the reliance on CVS and Walgreens and the box stores to actually be the distribution network, that's not going to work. And so the country has a long history of implementing vaccine campaigns, starting with the polio vaccine. And we're going to really need to look at an alternative approach that brings the vaccines into communities, that uses the network of elementary schools and other resources in communities, that focuses on equity in order to be able to distribute the vaccine. If we have 1 million people we need to vaccinate, I don't see 1 million people showing up at the Prime Osborne Theater, at the Prime Osborne, and or at the CVS's and Walgreens around the community.
Here's an email from a listener. In my opinion, large cattle call sites like the Prime Osborne don't do it. That's difficult for the elderly to wait in line. So yes, he says let's see more smaller sites. You know, the governor did reveal this week that some Publix grocery store pharmacies are going to offer the COVID vaccine to eligible groups. But, you know, Dr. Goldhagen, you mentioned the polio epidemic. Here's a tweet from a listener. In the early 60s, the polio vaccine was distributed at each elementary school over 2 Sundays. We waited in line on Saturday for 5 hours at the St. Johns County Health Department to no avail. This is inexcusable. Dr. Joshi, you know, it wasn't that long ago that the nation vaccinated successfully against polio, but yet we've seemed to have forgotten how to do this properly, which is mind-boggling.
It is, and it's also that our country has changed so much through the years. You know, back then, people actually, you know, believed in science. You know, and it's
right.
People listened to the.
They listen to Dr. Salk, and they're not listening in the same way to Dr. Fauci.
Right.
Yeah.
Right now, it's turned into science has become a political issue, and so it's making it even more difficult to get people vaccinated or to get people to understand the importance of the vaccine. And you know, we can talk about why that is, but certainly that's been one of the biggest challenges that we have now. And you know, and as Dr. Goldhagen said, I mean, it's, you know, yes, supply is an issue, but there's definitely an infrastructure issue as well throughout the state. And it is something that we could have definitely been on top of if our elected officials, especially at the state level, were looking at infrastructure from the very beginning and not just say, here, we're going to send it to the hospitals, we're going to send it to the Department of Health in each of these counties, including small little counties, and say, here, you guys figure out what to do with it. We did our job. Well, that's not the way it's working, obviously. You know, in Duval County, our hospitals received about 550,000 vaccines. In Florida, we received about 550,000 vaccines through the hospitals, yet we're nowhere near vaccinating that many people. So why is that? What is going on? And I think a lot of it has to do with our archaic scheduling system. You know, we were having people call a phone number at 8 o'clock last Wednesday.
And,
of course
and it crashed, of course. Hey, speaking of which, I know you have to jump off this call in a moment, so let me get a few more callers on for you and Dr. Goldhagen. Yeah. We're talking about the vaccine rollout this morning. Let us know your thoughts. 549-2937. Lynn on the south side. Go ahead, Lynn.
Hi, good morning. Thanks for bringing this topic out today. I just wanted to kind of weigh in. At the beginning, you were talking about, you know, people having enthusiasm for it. And, you know, our family is, my husband and I are in our 50s, and we've got kids in our 20s and late teens. And all of us are very, very enthusiastic and excited. And, you know, I think the biggest issue right now clearly is the shortage of supply and getting it, you know, organized to getting it out. But as soon as it becomes available for our age groups, we'll definitely be there. And we're, you know, we're all, I think, getting a little frustrated, you know, just feeling like every day that we can't get the supply and we can't get the organization, you know, people die. This has a real life consequence for everybody. So anyway, thanks for all your guests coming today.
Sure. Thank you. Dr. Goldhagen, Dr. Joshi, Florida right now is only vaccinating 3 priority groups: healthcare workers, long-term care facility staff and residents, and people 65 or older. Healthcare workers are EMTs, paramedics, Department of Health staff. Okay, so Dr. Goldhagen, obviously people outside of those groups are impatiently waiting their turn in line.
Yeah, it's correct. Absolutely. And, you know, the distribution network through the hospitals resulted in many people being vaccinated who don't fit in any of those categories. And so future distribution needs to be centralized so that critical decisions are made. If you look at pictures, and I ask you to do so, if you look at pictures in the media of the lines at the Prime Osborne Center, there were relatively few people of color, relatively few. And so the issue of equity distributing the vaccine to communities that have had the largest impact in their on the health and well-being of their citizens needs to be taken into consideration as well. We established this population health consortium of Northeast Florida, and the Duval County Medical Society is a prominent member of it. We have a number of recommendations that we've made to the city, and we would ask the city to consider those recommendations, not the least of which is engaging the Duval County Medical Society and the Northeast Florida Medical Society, the second one being the African American Medical Society, actually in the leadership that's making the decisions regarding not only the distribution of the vaccine, but responding to the pandemic.
And because you have to leave and get on a call with city officials, Dr. Joshi, what about that from Dr. Goldhagen?
Oh, he's absolutely right. I think, in particular, I think his point about looking at the videos and the people waiting for vaccines and seeing a relatively homogenous crowd out there in terms of ethnicity is absolutely true. And so part of the challenge that we have is to address city leaders about if we're going to have off-site vaccination clinics, which we need to have them in communities in which we have a disproportionate number of minorities, and minorities who typically do not seek health care. So in the Northwest Quadrant, in Health Zone 1, we really need to have vaccination centers there because, we're talking about folks who may not have transportation, who may not be well enough to stand in line when it's 45 degrees outside. We need to take the vaccines to the people, to the churches, to the groups where we can vaccinate the people in most need of being vaccinated.
Thanks, Dr. Joshi. I know you've got to hop off. We'll continue now with Dr. Goldhagen. Sunil Joshi with us, heading up the Duval County Medical Society Foundation. Sunil, thank you.
Thank you so much, Melissa.
And thank you. And let's get a few more calls on with Dr. Goldhagen, still hanging with us. Ray in Orange Park. Hi, Ray.
Hello.
Go ahead.
My question is, everybody's going to get this vaccine. Now, are they sure that once you get it, that it's not that we don't have to take the vaccine again, or is it going to be something we're going to have to do every year? And then, that's just been my curiosity. I think that's the reason why a lot of people haven't showed up to get the vaccine, because we haven't got enough results from it, maybe from all the tests to say, yes, this is once and done.
Thanks, Ray. Dr. Goldhagen, that's a question so many of us have. Will this be like getting the annual flu shot?
Well, I think the answer to that question isn't well known now. We do know that there is an antibody response that extends between 3 and 6 months, but it's not known if, in fact, we will need to get the shot every year. Our flu shots, in general, we don't do very well with. And you mentioned the flu shot. Dr. Joshi's been taking the lead in the flu vaccine campaign for this year. We only have about 40% penetration of flu vaccine every year in our community. So we need to do better with the flu, but it's clearly not known how long the antibody response will last to COVID-19.
Lots of tweets coming into the show. Robin tweets us, I got to the Prime Osborne an hour early, had my paperwork with me, and it was fast, took about 20 minutes. Very pleased with the result. Ellen tweets the show, have your guests on today's show been vaccinated? Did they have to wait in line for hours without availability of a restroom? So Dr. Goldhagen, what about that? Have you received the COVID vaccine yet?
Well, actually, I get my second shot at 10:30, and because I still work in the hospital, I'm a pediatrician. I work in Wilson Children's Hospital primarily through the University of Florida. I was one of the priority groups, and with respect to that, I would highly recommend everybody get the vaccine, and without question. But no, I didn't have to wait.
Yeah, you didn't have to wait in line for hours, which is, I think, where a lot of the frustration is coming from.
Yeah,
Stephanie,
sure.
Stephanie in Jacksonville. Hi, Stephanie. Go ahead, Stephanie. Go ahead, Stephanie. You're on the air. Well, she isn't listening anymore, but she's still got her radio on. She wanted to ask if the U.S. Postal Service could be used to expedite this. I've heard so many comments like that, Dr. Goldhagen. People have said, they ought to put Chick-fil-A in charge of the vaccine rollout, because when you go through a Chick-fil-A drive-through, it is run with military precision. And there's a lot of humor around this, just because I think there's so much frustration about the slow and messy logistical rollout. I want to give the websites again for people that haven't made an appointment for a vaccine yet. If you're in Duval County, go to duval.floridahealth.gov, click on the yellow COVID-19 vaccination updates banner at the top of the page to schedule your appointment. In St. Johns County, go to sjcfl.us to schedule your online appointment. In Clay, it's alert.claycountygov.com, and in Nassau, it's onenassau.com. Online appointments available this week to access vaccines for coronavirus. And, Dr. Goldhagen, we're also hearing that in some nursing homes, sites around Florida, wealthy donors were able to jump the line to get their vaccinations over other groups. There's so much happening with this, so much frustration. What are your final thoughts as people wait their turn to receive the COVID vaccine?
Well, it's pretty straightforward. The city, in collaboration with the health department, needs to mobilize all resources to, number one, address the pandemic. We have death and infectivity and sickness at higher levels than we were in the first wave. We know how to respond to hurricanes. We have the leadership capabilities. We have the resources. We need to think of this as a public health emergency, mobilize all the resources that we have, and respond as if this is the emergency that it is.
I want to thank you so much for your time, Dr. Jeff Goldhagen. He's former head of the Duval County Health Department and now Chief Division of Community and Societal Pediatrics at UF Health Jacksonville. Doctor, thank you.
No, Melissa, thank you. And thank your listeners. And just be safe, social distance, wash your hands, take care of yourself. The death statistics are just going sky high, and we don't want any more deaths in our community.
That's right. So again, make your appointment to be vaccinated. This is particularly right now, I'm talking to people 65 and older. In Duval County, go to duval.floridahealth.gov. Make your appointment to be vaccinated. In St. Johns County, if you live there, the website to make your appointment is sjcfl.us. If you are in Nassau County, make your appointment at onenassau.com. And in Clay County, it's alert.claycountygov.com. On all of those websites, just look for the COVID-19 banner that you will see on the homepage and go through the fields and make your appointment. We will continue to bring you updated information on this rollout as soon as we receive it here at WJCT News. Much more coming up on the show later. Some positive news and notes from your week. It's our What's Good Wednesdays. But up next.
This money is a recognition of the hard work of our teams and our partners, and also of the high need in our community.
A game-changing donation for the First Coast from philanthropist Mackenzie Scott, the former wife of Amazon CEO Jeff Bezos. She's giving billions of her wealth away, and many millions are flowing into our city and our region. What it means for all of us. That's next.
listen to us, so we listen to you. Tell us what you'd like to hear on Electro Lounge Radio. Let us hear from you at music@wjct.org. Electro Lounge Radio, part of the Jacksonville music experience.
Songwriter Phoebe Bridgers wrote a song about her dad and their complicated relationship. And when that song got a Grammy nomination, things got weird.
We have never discussed the song. And then the other day he called me and was like, so, we got a Grammy for our song. And I was like, oh man.
Next time on It's Been a Minute from NPR.
Saturday at noon on WJCT News 89.9.
Escape to a world of British telly on BritBox and PBS Passport when you become a supporter of WJCT. Sign up at jacksbundle.com today.
Welcome back. The science of robotics is helping lung cancer patients on the First Coast live longer, giving them hope. This new robot-assisted lung cancer screening tech is being used right now in our area. I learned more from Akash Modi, MD, director of the Baptist MD Anderson Cancer Center Interventional Pulmonology Program. Hi, Dr. Modi. Thanks so much for being with us.
Oh, thank you, Melissa, for taking time out.
It's good to get this information about what's going on at the Baptist MD Anderson Cancer Center, particularly since lung cancer is the leading cause of cancer-related deaths in the U.S. Patients with early-stage lung cancer often don't even have any symptoms. So screenings are really important. Tell us about this new, it's robot-assisted technology that you have now at MD Anderson to get a better diagnosis. How does this work? Tell us all about it.
Oh, happy to, Melissa. I think before I dive right into the technology, you brought up some very key points. Lung cancer is the leading cause of death, unfortunately, both men and women. A lot of patients, unfortunately, sometimes don't have early symptoms. And therefore, I emphasize and want to educate all listeners on the call today about the importance of lung cancer screening. If you are wondering about what lung cancer screening is, I highly recommend speaking to your primary care physician, if not a general pulmonologist or an interventional pulmonologist. We would be more than happy to discuss those and decide if you need lung cancer screening, because it's of paramount importance for your lung health overall. Patients who are diagnosed with suspicious nodules or indeterminate nodules, which means we're not completely confident if this may be cancer or not. The current diagnostic options are, namely, one is a biopsy called transthoracic needle biopsy, which is a needle from the outside of the chest into the lung, aiming towards the nodule. The other option is a bronchoscopic approach. The current bronchoscopic approach is a little limited for nodules that are in the periphery of the lung. And as a result, we sometimes have not diagnostic bronchoscopies. And as a result, patients unfortunately have to go through another procedure for diagnosis. However, with the new cutting-edge technology called robot-assisted bronchoscopy, it is robot-assisted. However, I would like to emphasize that it is still driven by the provider. The robot helps guide the bronchoscope into the periphery of the lung. However, it still is being driven by the provider. The important aspect of this is the technology has been built in such a way, it is pretty phenomenal in the standpoint that we are able to access nodules which are real in the periphery of the lung, and as a result, diagnose these nodules, and which may be early lung cancer. However, I want to try and weigh in one important aspect. The traditional needle biopsy that is done from the outside of the chest compared to bronchoscopic option has a slightly increased risk of something called a lung collapse, called pneumothorax. However, it's lower in the bronchoscopic approach. So whenever we decide any biopsy options with patients in the clinic, we always discuss the risks versus benefits. So with the new technology, the risks of complications are low, with the possibility of diagnostic yield being higher. So I think this is cutting edge and groundbreaking.
Okay. Now, you're so bullish about this. You say that with this technology, you can catch, diagnose, and even cure lung cancer at its earliest stages in some patients. That's pretty encouraging, given that we don't typically think of lung cancer as having great survival rates.
Oh, absolutely. I think that is important to understand. So I think this is where importance and emphasis on lung cancer screening and lung nodule clinic. And this is something I would highly advocate all listeners to speak to their providers about. So if patients are going to lung cancer screening, the concept is we detect nodules slash early lung cancer suspicious findings at an early stage so we can cure patients of their cancer. Unfortunately, if some patients have missed their lung cancer screening, or unfortunately were not considered as part of it, and if they're diagnosed with an aggressive stage, and at that time, the curative intent may not be the best management approach for them. So as a result, that might be challenging. So I think it comes back to the importance of real basics, which is lung health clinic, talking about smoking cessation, variables that we actually can control. Going through lung cancer screening if you meet criteria. If you're found to have an unfortunate nodule that looks suspicious, then discussing of the various diagnostic options that are available now.
Now, you said everyone should look at lung cancer screening. What are the guidelines for that? When should we start getting these screenings? Who should be getting them?
So lung cancer screening, depending on which criteria you decide, but I'm going to use the Center of Medicaid Services criteria right now for discussion purposes, is for patients aged 55 through 77, patients who've smoked for 30-pack year history in their lifetime and quit within the last 15 years or continuously smoke actively right now. Now, this is a very generic criteria. This involves a discussion with their provider about something called shared decision-making visit. It's a very fancy term, but all that it means is if you meet the above criteria, like I mentioned, however, also are willing to undergo treatment options for curative intent, then you should undergo lung cancer screening. The reason is because this screening is based on large evidence-based trials that were performed both in the United States as well as Europe, and we learned that patients who are willing to go through curative intent will benefit from the screening. However, if you don't, then you're putting yourself at further risk because there's a very small radiation risk also involved with lung cancer screening protocols.
Now, you said people of a certain age and smokers should be screened.
Yes.
Some people get lung cancer that have never smoked. Should they do a preventative screening too?
So that's a very good question that you asked, Melissa, and it's a common question that I receive in clinic as well. So unfortunately, the guidelines are very skewed about that. They don't specifically give you details. So like, let's say patients smoke cigars or patients have had secondhand exposure, like you mentioned. There's no direct guideline to say how much secondhand exposure. However, if patients have risk factors, a lot of secondhand exposure is an example, genetic history, family history of lung cancer, they could be screened. However, the insurance company may not pay for it, and if your provider and the patient are agreeable upon screening, it is about $115 out-of-pocket expense for a lung cancer screening CT, and that's a discussion between the patient and the provider, though.
All right.
So it can be occurred.
Well, in the meantime, thanks for sharing the news about the new robot-assisted technology for lung cancer diagnosis here in Jacksonville. He's Akash Modi, MD, Director of the Baptist MD Anderson Cancer Center Interventional Pulmonology Program. Doctor, thanks.
Well, thank you very much, Melissa, for having me on today.
Well, just before the holidays, philanthropist and author Mackenzie Scott announced she was donating millions to nonprofits in our area. Scott is the former wife of Amazon CEO Jeff Bezos and one of the world's richest women. United Way of Northeast Florida is getting $20 million from Scott. It's a game changer for the organization. Here's my conversation with their CEO, Michelle Braun. Michelle, good to talk to you. Thanks for being with us.
Thanks for having me, Melissa. Happy New Year.
Happy New Year to you, and what a great start to the new year for the United Way of Northeast Florida, given that you've received $20 million from philanthropist Mackenzie Scott, one of 3 nonprofits in our area, to get money from her. How exciting. That's a game-changing amount of money for your organization, isn't it?
It is really amazing. We are really humbled and super excited for our whole community as well as our team and our partners for this recognition from Mackenzie Scott.
And how will the money be used?
So this money is a recognition of the hard work of our teams and our partners, and also of the high need in our community. Ms. Scott, in her announcement, talked about the need for food insecurity, the need about facing us around racial inequity and high poverty rates, and of course that's what United Way is all about. Our vision is for a community of opportunity where everyone has hope and can reach his or her full potential. And unfortunately, we know right now that's not quite the reality of our community, and we will use these funds to help, bolster that mission and that vision.
And I would think with this amount of money, there will be a real measurable impact. This is so significant, and I would think it'd be a pretty big piece of your budget for the coming year or several years to really get deeper into some of these problems.
That's right. I do want to keep it in perspective for our listeners and maybe some of whom are donors. Every year, United Way raises and distributes about $20 million every single year. Some years it's a little more and some years it's a little less. And so it is significant because all at once we have this, amount of money that we can invest in our community. At the same time, it is important that people understand how critical United Way and our partners are to the safety net in our community. So we want to address both the immediate basic needs that we face right now, especially during the pandemic, and address the long-term issues that are underlying those needs. And we will have a planning process as we do with, right now we're in the middle of a strategic plan, so it's great timing to make sure that we use these funds to both support existing work that we know is making a difference, as well as to springboard us into diving deeper into tackling these issues.
And in order to get your arms around where the biggest pain points are in this community, you have a survey that you're asking people to take. Can you tell us about that?
That's right. Again, timing is really great. We had already planned to do a community needs assessment survey, which actually launched on Monday, January 4th, and it is available at our website, and anyone can take it. We really want to make sure those who have been impacted by the pandemic and the fallout, and that is, a range of people. Before the pandemic, we had 40% of people in our community could not meet a bare minimum survival budget. And so we really want to understand how the pandemic has changed that for people, and so that we can direct resources to help. So that the survey is available online at our website and through agency partners and other means.
And UnitedWayNEFL.org is where people need to go. And this is for people across the listening area, not just Duval County, right?
That's right. We serve a 5-county area, so Clay, Nassau, Baker, and northern St. Johns County. St. Johns County actually is part of this, too. We work with United Way there to distribute the survey.
Okay. So as we come out of the pandemic year that we've all been through, Michelle, and it's been so horrible, I think we're all hoping for a brighter 2021. As you plan ahead, as you mentioned, you're doing strategic planning. What are your biggest hopes for the year?
Our hope is that we will be able to come together to create an equitable community. And there's great opportunity with this gift, with the gift we also received from Henry Brown and the Brown family and Miller Electric to address racial equity. And we feel like we can build on the difficulties of 2020 and work on those issues in 2021 together and really show measurable results.
Well, best wishes, and thanks for being with us. She's Michelle Braun, CEO, United Way of Northeast Florida. Thanks so much.
Thanks so much, Melissa.
So that's some good news for this town and this region. And in a moment, we've got some more good news for your week. Our weekly blast of positive on Wednesday. That's next. Don't go away.
Announcing Vickers Landing at Oak Bridge, bridging retirees with an all-new Ponte Vedra Beach community featuring new homes, a resort lifestyle, and services tailored for active retirees. Information at vickerslanding.com. Congaree and Penn, dedicated to agriculture and culinary endeavors, offering field-to-fork dining and outdoor experiences on over 300 acres. Sip, dine, explore. Information at congareeandpenn.com.
On the next Fresh Air, Filipina journalist Maria Ressa. Her coverage of populist President Rodrigo Duterte has gotten her internet trolls, death threats, criminal charges, and Time Magazine's 2018 Person of the Year award. She's the subject of a new documentary called 1,000 Cuts. It airs Friday on the PBS series Frontline. Join us.
Today at noon on WJCT News 89.9.
Sometimes all it takes is one thing changing, like your kid's preschool shutting down.
You think that you have figured out your life in the pandemic and things are going smoothly and you can do it all, and then you realize you just can't.
I'm Kai Rizdal, working, parenting, and remote schooling, a balance that is impossible. We'll have it for you next time on Marketplace.
Tonight at 6, here on WJCT News 89.9.
A Democrat hasn't taken a Senate seat in Georgia in more than 2 decades. Privately, Joe Biden's team hadn't expected to win either race, so what happens now? Plus, how does the Republican Party now reckon with a leader who no longer delivers where it matters most, at the ballot box? I'm Jen White. We'll get to all of it next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. Well, we finally kicked 2020 to the curb. Feels good, doesn't it? As the new year begins and the vaccinations roll out, albeit in a bumpy fashion, and we shake off the doom and doldrums of the last year, we've got lots of positive vibes to share with you. It's our What's Good Wednesdays. Let's begin with Sunray Cinema in 5 Points. They're getting a permanent drive-in movie theater. Now, fans of Sunray know that they've been hosting dozens of these pop-up drive-in movies all over town in the pandemic because they're safer. It's so popular that they're building a new one in Murray Hill, Riverside, by the Metro Entertainment Complex. You're going to see an outdoor auditorium, a 50-inch movie screen, even a concession trailer. We'll hear more about Sunray's cool expansion on Friday's show, so be sure to listen in for that. Well, thousands in this area are struggling mightily just to make ends meet. You can let this region's premier charity know where you think the biggest pain points are right now in your home, your neighborhood, by filling out a simple survey for the United Way of Northeast Florida. Residents of United Way's service area, Duval, Baker, Clay, Nassau, and St. Johns counties, are all invited to complete the survey. Now, they specifically want to hear from people struggling due to the devastation of the pandemic. This survey was developed in partnership with United for Alice, a group that works with United Ways across the country to analyze data on households that are struggling, including families in poverty. Check out the 2021 Community Needs Survey at United Way of Northeast Florida's website. That's unitedwaynefl.org. Make your voice heard. Well, finally, we want you to check out an amazing performer coming to town this weekend for a safe and socially distanced show at the AMP. Raul Malo, lead singer of the Mavericks, is doing a rare solo date at the AMP Saturday night. I talked to him about why he's so excited to get back out on tour after a whole year on the sidelines due to COVID-19. Actually, we don't have that cut, but basically what he talked about was how excited he is to be performing again because, you know, for bands and musicians, they've just not been able to get in front of audiences, which has been very hard for them. And he's very excited about the opportunity. Do we have his? Here he is.
Oh, my gosh, yeah. I don't know that there's a musician on the planet that's not ready to get back to touring. You know, it's something that, you know, you do it your whole life and you're geared up for it. You know, you're made for it. Your whole life is revolves around performance, revolves around a tour. So in order to not have that, it's been different, for sure. I'm more than ever looking forward to getting in front of a live audience.
So check him out Saturday. Raul Malo of the Mavericks with special guest Seth Walker at the Backyard Stage at the St. Augustine Amphitheater. Saturday night, January 9th at 8 o'clock. Tickets and information at theamp.com. And right now, we're going to enjoy a little more of Raul Malo. Here he is with his band, the Mavericks. Enjoy a little music as we close things out, and thanks for listening. Our producer is Heather Schatz. Josh Torres is show director. Our news director is Jessica Palumbo. Bill Bortsfield is our digital editor. Keep those emails coming. We appreciate the feedback to firstcoastconnect@wjct.org. And make sure to catch our podcast up later today, wherever you listen. I'm Melissa Ross. This is First Coast Connect on WJCT News 89.9. We'll be back at 9 a.m. tomorrow.
Since you heard I was through, but here I am, back in your arms again. I heard from someone that you were back in town. I knew I couldn't stay away. No matter how I try, this love won't be denied, and here I am, back in your arms again. Oh, here I am, back in your arms again. I should know better, but what does it matter to my lovesick fool? I know I said never, but I know forever I'll come back to you. I'll keep coming back to you. I should know better, but what does it matter to my lovesick fool? I know I said never, but I know forever I'll come back to you. I'll keep coming back to you. Once I said I'd never want your love again. You showed up tonight and proved me wrong. Things I said I'd never do, since you and I were through. But here I am, back in your arms again. Oh, here I am, back in your arms again. Oh, here I am, back in your arms again. Yeah,
Support for First Coast Connect is provided by Baptist Health and the North Florida TPO.